Sickle cell diseases are very common. Even if you don't have sickle cell, at least you know somebody that knows somebody that knows somebody that have sickle cell diseases. Even in your classroom, you might know someone that have sickle cell diseases. In your churches, you might know somebody that have sickle cell diseases. In your workplace, you might know somebody who knows somebody that has sickle cell diseases. So sickle cell is a very common disorder. Sickle cell disease, it is an inherited disorder which causes the body to produce an abnormal hemoglobin. Now, hemoglobin is a part of the blood which helps in transportation of oxygen around every part of the body. Healthy red blood cells can move easily around the body, but for sickle cell patients, due to that abnormal hemoglobin, blood cells are like letter C shape, so they cannot move easily around the body. Due to these abnormalities, the red blood cell cannot carry oxygen freely around the body. And we know when oxygen is not being distributed effectively around the body, it can lead to tiredness, it can lead to drowsiness. A healthy hemoglobin can live up to 90 to 120 days in the body. But you know, a sickle cell hemoglobin can only stay 10 to 20 days. They have a shorter lifespan to stay in your body. And when the sickle cell hemoglobins have shorter lifespan to stay in your body, it further worsens the complication of what? Anemia, sickle cell anemia in the body, and clumping and the blocking of blood vessels. Talk about the clumping and the blocking of blood vessels. Because blood cells, they don't move freely around the body. They keep clumping together, and when they clump together, they block blood vessels. And when blood vessels are being blocked, it starts restricting the blood flow to different parts of the body. This is reason why there is frequent pain in anemia. You know, when there is always a clump, and those clumps are steadily blocking blood vessels, and when blood vessels are being blocked, it restricts transportation of blood around the body. And when there is restriction of transportation of blood around the body, this is one of the major reasons why there is frequent pain in sickle cell anemia. As with sickle cell anemia, they need to consume at least 4 to 5 liters of water daily. Do you know why? Because this water will help to prevent clumping of red blood cells, thereby improving the way blood is being distributed around their body. Why normal human beings need 2 servings of fruit daily, a sickle cell anemia patient needs at least 5 servings of fruits daily. Do you know what this fruit does? This fruit will help to combat what? So many other inflammations that comes with what? Sickle cell anemia. Sickle cell patients, they need a lot of proteins and energy. Why they need proteins and energy is that this protein will help to keep building new blood cells because of the low lifespan of their blood cells. You know, when the blood cells are dying, new proteins and energy will help to do what? Building what? New blood cells.